laparoscopic surgery, which just means that the same surgery what is done open technique. We open the abdomen and then whatever we are doing can be done with very small incisions. Nowadays, nobody has the time to sit in a hospital for like 7 days, 8 days. So maybe 1 or 2 days stay at the hospital. So that's how short it's cut. Everybody thinks that it is a cosmetic surgery. This is not cosmesis. First, we need to understand that obesity is a metabolic disease. It's a very complex disease. Non-surgical weight loss methods, which are also good, they're also effective. So we need to analyze each person and understand and then go forward with whatever is required. Everybody is just seated. There are a few people who sit for 12 hours straight and all of that. It's alarming. Our world is driven by IT nowadays. So that main industry, this is the work culture. So definitely all of this is affecting our lifestyle. The worst weight that you can actually gain is called visceral fat. The fat.
The fat around organs, right?
Exactly. That's the worst. Obesity right now is worldwide by WHO recognized as a disease.
Today we're going to discuss about a growing medical concern that affecting many Indians, obesity and its surgical treatment available for it. For that, I have an expert doctor with more than 10 plus years of experience. Meet Dr. Preethi ma'am, renowned laparoscopic and bariatric surgeon. Vanakkam Dr. Preethi ma'am. Thank you so much for joining with us.
Thank you so much.
It's a pleasure to have you here, ma'am. Can you share me your journey into medicine and especially on laparoscopic and bariatric surgery?
Okay, so when I was doing my MBBS itself, usually in the final year of MBBS, we get posted in different specialities. Throughout MBBS, but the main fields. So those will get posted in the final year. So at that time, I got posted into different specialities, and general surgery really caught my eye. I don't know, I've always felt that I had a calling for it. It was always that I was only discouraged by everybody around me because mainly it's a field of men. It's men dominated there, and also it's very physically demanding also, not only mentally, it's also physically demanding because we have to stand for very long hours in the theaters, OTs and all of that. But in spite of all odds, I just couldn't push myself to take anything else. So I really wanted to take general surgery, and that's how I got into it. And when I started my journey as a postgraduate into general surgery, I slowly started leaning more towards minimal access surgery, that is laparoscopic and robotic surgery as well. So I started pursuing that line.
For some viewers, they are not aware of what is laparoscopic surgery and also as robotic surgery. Can you please share us some words about it?
Okay, so when we say laparoscopic surgery, it just means that the same surgery what is done open technique. We open the abdomen and then whatever we are doing can be done with very small incisions. Colloquially, we say laser surgery, colloquially, but it's actually laparoscopic surgery. Just smaller incisions, and we fill the abdomen with a little bit of gas and then introduce some instruments with which we work and do the same procedure. So that way what happens, the scar is less. There is no opening. There is no drastic cutting involved there. So the patient feels much more comfortable, quicker recovery and faster return to work. Nowadays, nobody has the time to sit in a hospital for like 7 days, 8 days. So maybe 1 or 2 days stay at the hospital. So that's how short it's cut. And return back to work in less than a week's time. That's what we usually say for, gallbladder, hernia surgeries and all of that.
So it's great to hear. Most of the patients always fear for getting into a surgery because it takes so much of time for recovery period.
Yeah.
So as you said, so what are the common condition people used to come to you?
Okay, so usually the common cases that I handle are hernias, gallbladder surgeries, and I also handle breast issues, piles, and any bottom issues, piles, fissure, fistula. And now I've also done my fellowship in bariatric surgery, which means the weight loss. So I specialize in weight loss as
That's
well.
the biggest concern of most of the Indians, ma'am. Due to unhealthy lifestyle,
Yeah, that's true.
most of the people are facing on weight gain. So, as you said, we have been into laparoscopic surgery, so where the recovery period will be reduced into 1 to 2 days. So, what are the myths that have been commonly circulating in among peoples about weight loss, about surgeries?
First of all, everybody thinks that it is a cosmetic surgery. Okay, this is not cosmesis. First, we need to understand that obesity is a metabolic disease. It's a very complex disease. Just like how diabetes, hypertension, cholesterol, and other morbid conditions, this is also a very morbid condition. So, to treat that, we need a multidisciplinary team, right? It's not something where you just come, oh, nanga matre, you take this medicine, you'll be okay. That's not how obesity works. It's a multiple things, and it is the common denominator for every morbid disease. When I say morbid or chronic disease, it's more like diabetes, hypertension. If you take all of this, you will see that 90% of the patient will be obese. So when we correct the obesity, this will immediately get corrected. So first of all, the one thing that I want to clarify that it's not a cosmetic procedure. It is a metabolic procedure. Okay, so a lot of things after this metabolic surgery, that is bariatric surgery, even your diabetes can get reversed.
Oh,
If not completely reversed, your insulin dependency will definitely come down.
okay.
Your hypertension can definitely be cured. You can stop taking hypertension medications,
Okay.
provided the hypertension is because of your weight, right? Even heart issues are getting sorted.
So it's like there will be one surgery which has been related to many problems.
Exactly. But there is so much stigma around it. There's so much, people just don't understand. Because I feel like we are a very conservative group of people, myself included. All of us are very conservative in certain angles. I think we need to open up further and look further if you really want help.
By listening to you, so much of questions that comes to my mind because I have been facing a lot problems regarding the issues you have been saying. So, who are the peoples they need bariatric surgery?
Okay. So the indications for bariatric surgery, not everybody is okay for bariatrics. Now we have non-surgical weight loss methods which are also good. They're also effective. So first, bariatric surgery, who can do? People who have tried all sorts of diet and exercise and other modes of weight loss and have succeeded temporarily but regained their weight back, and the BMI, the body mass index, is about 35. About 30 with some comorbidities is okay, but about 35 with or without any comorbidity. When I say comorbidities, it's again diabetes, hypertension, heart disease, and all of that. If that is not there, if that is also there, then about 35. But above 40 is a definitive indication, BMI. And then there are other parameters we also evaluate, which is a waist to hip ratio, and then your visceral fat percentage, your muscle percentage, all of this. So basically, we do something like a body composition analysis, understand the composition of the body, and then suggest which procedure or which approach will be good for that person.
Okay.
So what might work for you will not work for me. So we need to analyze each person and understand and then go forward with whatever is required.
Okay. So here is a point. Correct me if I was wrong. People used to say while gaining weight, the first on your stomach only the most of the fat settle down. Is that true?
Partially true.
Okay.
It's not on your stomach. It's more, we call it as central obesity. Okay. And when I say central obesity, the worst weight that you can actually gain is called visceral fat. Okay, the worst fat.
The fat around organs, right?
Exactly. That's the worst. So that is something is also included in the body composition analysis. We also find out how much of visceral fat you have. A normal should be less than 9 or 10, or even up to 12 is okay, but nothing more than that. But few people we've seen, people have like some 20, 27, 28. These are alarming numbers.
Okay.
Why it's alarming is because when a fat surrounds the organ, it just compresses externally and simply doesn't let it function as good as it should be.
Okay.
So, as and when that fat keeps accumulating and increasing, as it is, the organs are working overtime. Because our organs are made in a sense where it can only work for, say, a 80 kilogram weight. You can stretch it by 10-15 kilograms, but we can't stretch it double the time, no? So already our organs are, there is no physiological reserve. That is what we coin it for obese patients.
What are the common mistakes people used to do in their lifestyle?
So common mistake is, I'm not sure. See, when I was very young, we used to go out and have outside food or go to a hotel maybe once a week. Maybe. Okay. But I'm sure the current generation is not so. See, I have my own daughter. My daughter, like every other day, she'll come. She'll be like, oh, Mom, I don't like this food. Can we order?
Oh.
You know?
It's easy to take an alternative.
So now outside food is readily available. So it's made our lives easy, definitely to an extent, but it's also weakening our system. Our health is definitely going down because outside eating is become so common these days, there whereby there are people living on it.
Okay.
Because I get certain children, I won't even say adults, they're like early 20s, like 21, 20-year-olds who are in hostels and studying and all of that, or working. They say, where will I cook? I can't cook. So I only eat outside.
Okay.
So they come with a number of issues, and one among it is obesity, and next thing is this fatty liver, and because of obesity, one by one everything gets added on to it. So that's one. Another is immobility or
True.
activity.
Staying in a place for a longer time.
Yeah. So our nature of our works, our jobs are also like that only these days, whereby we are only sitting in front of the system, or it's just meetings and meetings and phone calls and phone calls. Everybody is just seated. There are few people who sit for 12 hours straight and all of that.
True.
It's alarming. It's alarming to even understand it, to even wrap our head around all of that. I mean, my job is not like that. We need to keep running around, standing around. But there are jobs that are like that, and predominantly the IT industry.
Exactly.
Our world is driven by IT nowadays. So that main industry, this is the work culture. So definitely all of this is affecting our lifestyle.
While discussing about the problems, we should also discuss about the remedies.
Yes.
So what are the things they can do? Make a small alternative that can change people's life.
Small alternative number one I would always suggest is don't skip your breakfast. They think intermittent fasting is a trend, so let's just skip that breakfast. Or they think it's easy. It's for easy. I wake up, I'm always in a rush. I woke up late, so let's skip breakfast. Please don't skip breakfast. Breakfast is the most important meal of the day. And don't eat unhealthy breakfast. Just to have 2 eggs, or if you're a vegetarian, just have a couple of fruits, a fruit bowl. Please don't get anything packaged. I would say cook at home and eat. That's the best food always. Even if you feel like having biryani and indulging in something, try to eat it at home. Try to make it at home. This is one thing when it comes to food. When it comes to activity, we should remember to move every couple of hours. So definitely morning, afternoon, evening, there are breaks. Morning we move and come, and then afternoon, and then evening. So only 2 times you have to remember to get up and move. So it's not a big deal actually if you think about it. So mid morning, make sure you get up from your seat, go walk, 10-minute walk, do something, and also like make sure you take the stairs. Small changes you can inculcate, but they have to be very conscious decisions. Make a habit out of it. Make activity your habit. Make clean eating your habit so that it's not pushed, right? Like, and you follow only for like 5 months, 6 months, and then you're like, okay, I achieved that weight, let me go back. It doesn't work that way.
I just want some words from you to the audience who are listening to this video. Instead of a doctor, I just want some words from Preethi ma'am, as a woman who have come across so much of journey. Just share some words who are they listening to as a pregnant woman. What are the things they should listen? What are the things they should follow? It could be a motivational things you have been come across, because most of the, as I already said, most of the women have been mainly affected after the pregnancy due to their weight.
For the weight.
They feel so insecure.
Yeah.
That's the main thing. We used to, there is a medical term in it too. What we used to say.
Postpartum.
Exactly. So what are the words you want to say to the people over there, man?
So one of the main things that I want to tell every woman out there is that what you're going through, this weight gain and all, is very, very normal. The first thing that you need to do is normalize it. So even I had that panic when I was pregnant, oh my God, the weight is moving, the scale is moving, I'm climbing up the scale, what do I do? But one thing that I told myself is it's okay, because what our body is going through is one of the best things that can ever happen, because it's literally a miracle, right? Bringing a child into the world is nothing but a miracle. So once that is done, we have a lot of ways and modes to lose that weight. It's not undoable, right? All you have to do is put in your mind into the right things. Right now, advice is free. So there are thousands and millions of people going around just throwing advice, do this, do that, you try this drink, you can lose weight. That's all just not true. The only thing that will actually work is sheer hard work. You have to put in the time and energy to make sure and take care of your health. That's all. I wouldn't even say lose weight and look nice. It's not about looking nice at all. That's secondary. That's a added thing that comes along with it. It's more about how we take care of our health.
Thank you so much for sharing it, ma'am. As we already discussed, most of the people delay surgery because of fear. So, as a doctor, what are the things people should understand when it comes to surgeries?
Okay, so first of all, any surgery is only done when the benefits outweigh the risks. Every surgery has risks, okay? But the risk rate and is almost nullified or brought to very minimum by a team of experts, by exceptional care, okay, and a multidisciplinary approach. When this has been done, right, the risk is almost, it's not there.
Okay.
So there are so many benefits to bariatric surgery, which the ones who have actually undergone will be the perfect people to actually give you a testimonial of how life-changing it is.
Okay. When we have been said about testimonial, do you remember any incident that comes to your mind? Like people having a worse condition and after the surgery they have been
like multiple. One that is actually quickly coming to my mind is one of my patients actually came in. She was pretty big, okay, and very short. If you look at her, you would probably say she's like 45 at least age old. That's how she looked, but her age was only 32. So by the time she walked and she even sat down, she's very breathless. She's not able to breathe properly. So I'm asking her, so what is the issue? And then she has to take a couple of minutes to breathe, calm herself down. She's profusely sweating. She's not okay. And then she tells me, doctor, I know I have a lot of issues, but I know my weight is the main issue. And now my husband, slowly, I kept like probing, asking her about other things like, do you snore? Do you have knee pain? Do you have back pain? Do you have diabetes, hypertension? The answer was yes to everything.
Okay.
Almost everything. Okay, and then finally she opens up and she tells me my husband wants to divorce me because I'm not able to have a child. So that was, this is not just one case, you know, it's very common. It's very disturbing also because the lady is so heavy. She's very heavy. And then we said, okay, like, you know, the main thing, just addressing things superficially is not going to make it.
True.
So deep down, we need to dive deep and find out what exactly the issue is. And for that particular lady was her weight. So she did undergo bariatric surgery. You won't believe it, like she is so happy right now.
Okay.
She's extremely happy. She's half her size. She's extremely happy. Her husband's also very happy. Everybody is happy, right? But it takes that leap of faith.
Okay. And one of the another myth that comes to people is that when we go through a surgery, there will be a lot of side effects after the surgery. Is that true?
That's very true.
Okay.
That's very true. Nothing, so always something good always has something, at least little bit of negatives as well. So, but those can be targeted and kept under control.
Okay.
So with bariatric surgery, the most common negative aspect, not negative, but one of the side effects is that there can be nutritional deficiencies because the absorption of whatever you eat is very less, so nutrition deficiencies can take place. But in that case, we'll give you particular medications for that prior itself.
Okay.
From the time the surgery is over, we don't wait for the deficiency to present.
Okay.
So before that itself we start, and then this can be contained. It's not a very major side effect at all. Apart from that, I think there will be a little bit of muscle loss as well, along with fat loss. We can't only have fat loss. It doesn't work that way. So for that, we ask you to take adequate proteins. It's a multidisciplinary approach again. There has to be a nutritionist, there has to be a doctor. It's not like just, you know, a single doctor just does the procedure and then it's over. That's not how it works.
You said about the benefits a person can have when they undergo bariatric surgery. So, what are the lifestyle changes they need to change after bariatric surgery so that the effort will have a long-term benefit?
Okay. One small tip I would like to say here, not just for post-bariatric patients, also for all of us. One small tip is that the moment you start feeling full when you eat, stop. For no reason should you continue. So the reasons are plenty. One of the reasons is food shouldn't get wasted. Just by saving this 2 mouths of food, you're not going to resolve world hunger, okay? But you're going to do more damage to your body. I will explain why. Another thing is people think and very common thing is it's very tasty. So we take that extra 2-3 spoons.
Extra 2 bites.
Right? So our body, if you want to maintain something, right, it's more about training the brain, training the mind. So that's where the trick lies. So the moment you start feeling full, stop. That is one thing that I tell all post-op bariatric patients. And then another thing is activity.
Okay.
Definitely post-bariatric should be some amount. Usually they feel very brisk because they were in a phase where they were barely able to move around. Now, once the body weight has come down, you will see that they're more brisk, you know, they're more happy doing their work and all of that. So these are the two main things that we say.
So when we are speaking about a bariatric surgery has evolved over years. So what is the most recent improvement in bariatric surgery?
So one of the best things that's actually happened, not just in bariatrics, but also in the field of surgery, is the evolution of robotics, especially in bariatrics. The reason being is very obese patients, it's a little difficult for us to do things laparoscopically. There's a lot of talk, the patient is heavy, and it's pretty difficult to go about the procedure. But that is bypassed by robotic surgery. So that is one of the best advancements that's come right now.
It's great to hear, ma'am. What are the things people should look out for when it comes to obesity?
Okay, so one of the few things that you need to first do is check your blood parameters.
Okay.
Okay, almost once in a year is more than sufficient. But if you have any deficiencies, any derangements, then those parameters alone every 6 months needs to be checked. And in those give you a vague idea of what's actually happening inside your body. In that, there are a few parameters that I usually check. One is your serum cortisol, another is your fasting insulin. So if your fasting insulin is pretty high, it directly shows insulin resistance for you.
Okay.
The chances of you being on the obese side is going to be higher. So then you get alerted, and you need to do the needful. So that is an early indication in case in case the person is not heavy or anything, but you still want to keep it at check. Maybe because your parents are heavy or your grandparents are heavy, your family has obesity, but you're still not obese. So this is for them. So you can do that. Another thing is to check for signs like if there is like some black lines, or obvious black
Foldings.
around the neck. Those are called a condition called acanthosis nigrans, which is also more commonly seen in obese people, and because of insulin resistance. You can also get small tags all over, black tags kind of things, that also shows some amount of resistance.
Okay. So if a viewer is getting all those symptoms, what you have said so far, what is the first step they need to do?
Immediately check your waist to hip circumference.
Okay.
Don't just rely on that scale.
Okay.
The weighing scale might not really be true. So immediately check waist to hip circumference is so crucial, and it's a very clear indicator. So we need to divide it, and when we do, the value has to be less than 0.85.
Okay.
And if it's more, which means that you're into the obese category.
So this formula seems new to me. So what is the formula of it?
Waist by hip.
Waist by hip size.
In centimeters.
Okay. And the value should be?
Less than 0.85.
Okay. Finally, what are the words of yours to a person who is struggling with obesity, but they are hesitate to seek for help?
So I wouldn't really say it as an advice, but more along a friendly tone, that you don't have to go through it alone. It's not just about looks anymore, because there is the right kind of help available, and obesity right now is worldwide by WHO recognized as a disease. And just like any other disease, this needs to be addressed, and this needs to be limited as well.
Thank you so much for your valuable words and advice on laparoscopic and bariatric surgery, ma'am. Thank you so much. Really means a lot. Thank you.
Thanks for having me.